video, I'm going to take you step by step through the procedure of venipuncture. We will start by assembling the equipment, reading the blood request form, and then going on to obtaining the sample from our volunteer. During this demonstration, I'm going to take you step by step through the role of the phlebotomist, from meeting the patient, going through the blood request form, and thereafter obtaining the blood sample. Good morning.
Morning.
You're here for a blood test?
I am, yes.
Do you have a form?
I do.
When the patient presents you with a form, it will have their name, their date of birth, also their NHS number, hospital number, requesting physician, and medical information. Here, we come down further, it indicates that it's a blood request form, and then shows you the requests of the samples to be taken. Here comes into play for the consent and also the identification of the patient. Can I take your name and date of birth?
Jane Smith, 10/6/65.
Lovely. Are you happy for me to take your blood today?
I am.
Okay. If you'd like to present your arm. So once you come to the patient and they're sitting comfortably with their arm rested, you can ask them to remove the item of clothing that's obstructing the area that we will use. Once the patient's comfortable, we clean our hands. This is the first step within the 5 steps of hand hygiene. We place on our gloves. From our equipment that is set out on our workstation, we would pick a vacutainer, a needle, the tourniquet to apply to the arm, an alcohol wipe, plus cotton wool, medical tape, and the test tubes for what's requested on the form. I'm just going to place the tourniquet on your arm. It'll be a little bit tight for a moment. You ask the patient to raise their arm. If their clothing is thin, you can always suggest for them to leave it there to save the tourniquet pinching the skin on the arm. Apply the tourniquet by putting the plastic clip through the pre-made holes. You can ask your patient, if they're able to clench a fist. A nice tight fist, but not to tense the arm. The arm lays comfortably for the patient, but also for yourself. We then take our finger and pop out the area that we think the vein is. Once we've located, we proceed by wiping the arm. Take the wipe from the packet and wipe for 30 seconds. Take your vacutainer and needle, unsheath the safety needle, place it into the vacutainer, screwing it on, making sure not to over tighten it. Have a look to see that the bevel is placed upwards. Always have your equipment in easy reach, or if your patient is of capability, they can hold the equipment for you. If you could hold that for me. Okay, so it's going to be a sharp scratch, nice and still. You get the needle at a 15 to 30 degree angle and straight into the vein in a slow but smooth motion. Take your first tube, in this case it's a blue one for an INR, and pop it on. The blood fills into the tube very quickly and you've obtained the sample. Give it a little shake and move on to your next. Hold the tube with your fingers behind it, thumb on top, and place it into the vacutainer for the needle to pierce the circle. Once the sample's taken, again a little shake. Place the cotton wool above the needle, retract the needle and clip on your safety holder. Pop this straight into a sharp spin. Remove the tourniquet and ask the patient to press firmly on there for 2 minutes and relax their hand. You have your samples. You take this time whilst the patient is pressing on the cotton wool to fill out the paperwork and either place pre-printed labels with the patient's information over the sample tubes or handwrite them with the information of name, date of birth, hospital number, time that it was taken, date that it was taken, and your initials. And then they go into a specimen bag with the requesting form, placed into a bag that will be taken up to the lab. Check the patient has finished bleeding. Pop the cotton wool back on. Apply tape and advise your patient that they can remove that after 10 to 15 minutes. And there we have it. In the video of the live venipuncture, this was just a tool to show you it in practice. This is not a learning tool. Please do not practice venipuncture on a human unless you have the supervision of a health professional. Thanks for watching.